Osteoarthritis is one of the most common types of arthritis, affecting an estimated 21 million American adults and costing our healthcare system nearly $100 billion every year. Well, today we're going to talk about available options for relieving pain and symptoms of osteoarthritis of the knee. And we're talking with expert Dr. Stan Dysart, orthopedic surgeon at Pinnacle Orthopedics. Doctor, thank you so much for being with us.
Danielle, glad to be here.
What is osteoarthritis, or OA?
OA is a disease where the joint actually deteriorates over time. The cartilage cushion, the slick substance at the end of the knee, it wears away, and the liquid in the knee, which is initially thick, breaks down and becomes thinner.
Okay, so what are some of the symptoms then that we should look out for?
My patients, when they see me, they complain of joint pain, their joint hurts, it grinds, it's stiff, it can swell.
Are they thinking, though, arthritis or osteoarthritis? Because a lot of times when we have knee pain, we think maybe we bumped it or maybe we just kind of slept on it wrong. So that may not be the first thing that comes to mind for many of your patients, is it?
They often don't know, but arthritis is a pretty common term. They'll say, I have arthritis, which they may or may not have. All they know is their knee hurts and they need to see a doctor.
What are some of the causes of OA? There
are many causes. As people get older, they have more OA. It's more common in females. That's not a cause, but it's more common in females. If you're overweight, you have a greater chance of getting OA. Genetic factors play an important part, especially if it runs in your family. And of course, trauma. If you're sports-minded, trauma can cause OA.
We know the majority of our audience here on The Balancing Act is female, and I thought that was an interesting statistic. It affects 65% of women, 35% of men.
Yes, it's much more common in women.
Why is that?
No question about it.
Do we know why?
We don't know why. We think that it may have hormonal aspects of it. We're just not sure. But more women have it than men.
Doctor, how is it treated?
There are many ways to treat it. Initially, exercise, and if you're overweight, lose weight. Weight increases the chance of arthritis significantly. You can try oral therapies like aspirin, non-steroidals, and then there's a new class of products, which is an exciting class of products, injectables called hyaluronidates, who actually inject this substance into the knee to lubricate it.
Well, so the good news is that it is manageable, especially if it is caught and treated in the early stages.
The earlier we can catch this, the more manageable it is, no question about that.
You talked about the HA injections just a little bit ago. Who's the candidate for these injections?
Well, there are 5 products in this country where we can inject into the knee. There are 4 products that are animal products, and there's one exciting new non-animal or a non-avian product that we can use. Candidates, if you have OA, if you failed other therapies, then that's a good thing to do. Inject the knee with HA.
Where can we go for more information?
There are a number of very good websites. Go to the Arthritis Foundation website at www.arthritis.org or go to Euflexa, www.euflexa.com, which will talk about injectables and OA.
And finally, with just about 15 seconds left, the best piece of advice you can offer women and men out there who may be suffering some kind of inflammation or problem with their knee, what would you say to them?
Lose some weight, watch your diet, get the right exercise, and see your doctor. Only your doctor knows what you really have.
All right. Well, doctor, we do appreciate you sharing this insight with us here this morning on The Balancing Act.
Thank you, Danielle.
Thank you.